A new script for care management. Or better, a new script for social work, produced by the Centre for Welfare Reform in association with Paradigm and with support from Yorkshire and Humber Joint Improvement Partnership. People think personalisation is a big problem for social workers. So let's have a look at personalisation and social work. Social work is the art of helping people be active citizens. In practice, citizenship means being in control, with direction, enough money, your own home, enough help, and being active in community. But citizenship isn't easy. Poverty attacks citizenship. And poverty comes in many forms: loss of hope, no power or control, disadvantage, exclusion and prejudice, isolation and abuse. So social workers challenge poverty. And social workers do this by inspiring hope and recovery, empowering individuals and families, strengthening personal development, connecting to community, building safer networks. But social workers cannot do this on their own. These are not things you can do for people. These are things you have to do with people. In fact, social workers can only help people by working in partnership. People bring about change in their own lives, using their own real wealth. Resilience, hopeful human spirit. Control, money and the power to use it. Strengths, gifts, skills and knowledge. Community, opportunities to join in. Relationships, safe and loving networks. From real wealth to citizenship. In partnership. This defines social work and defines personalisation. Personalisation is social work. So what's the big problem? The big problem for social workers is the old system gets in the way. The old care management system makes it hard to do social work. It's really hard to empower people without entitlements, strengthen capacity focusing only on needs, connect to community inside segregated services, build safe networks without family, friends and love. So, social workers and others have been trying to reform the old system, with lots of innovations, individual budgets, support plans, person-centred plans, resource allocation systems, self-directed support, personalised support, direct payments, independent living, peer support, local area coordination, outcome-focused reviews, community brokerage, supported decision-making, tapered control, personalised transition, recovery, outcome stars, family leadership, asset-based approaches, think family. Although this can all get a bit confusing. But there is an easier way. Replace care management with self-directed support. This means social workers can empower people, tell people their budget, strengthen capacity, focus on personal outcomes, access community, use funding flexibly, build safe networks, work with family, friends and others. Now, all of this sounds absolutely fabulous, except for the same big problem. We're all still working in the old system. We've changed words, added new complexities, but the system is still the same. Social workers sometimes even feel personalisation has made things worse. Systems sit on systems like sedimentary rock. Social care law for children and adults, mental capacity law, comprehensive assessments, monitoring systems, care planning, eligibility criteria and resource panels, joint assessment processes, annual reviews, protection, safeguarding responsibilities, care management. Personalisation is becoming one more system. We must simplify and redesign the whole system so that we can fulfill our legal duties, harness the power of personalisation, cut out bureaucracy and confusion, make social work more fun and fulfilling. In 2010, social workers in Yorkshire and Humber began to write a new script for social work. The new script looks like this. Assess people's eligibility for guidance, rehab or a budget. Assess capacity and clarify where the leadership is, the individual, a representative or a professional. Don't plan for people, instead enable other people to plan. But always make sure that you give useful information, connect to another individual or family, refer to community organisations, recommend appropriate providers. Or plan with people directly yourself, especially when it's a critical situation, the solution is obvious, or nobody else can help. Agree plans as soon as possible if they are sensible, safe, and in budget. Plans should not be perfect. If people need help to set things up, then direct them to the right people and places. It is the review that is central to really learning what is working and to helping people be in control of their own life. This is a new script for social work. What the new script means is things speed up. Bureaucracy goes down. Social workers use their best skills people connect to community, but most importantly, lives are transformed. For example, people have turned the funding that used to pay for residential respite into more effective, inclusive and positive experiences with support from family and friends. The new script helps us to empower people and families in control of their own lives, strengthen capacity, people living positive lives, achieving, growing, access community, people as active citizens, build safe networks, reducing abuse and isolation. Do you want to find out more? Follow this link, contact Kate Fulton and join the project.